So I begin with chapter one, talking about unpredictable outcomes in neurosurgery. And I do that to show the lack of precision of what we do. And I picked what should be the most straightforward, easy case, right? It's an epidural hematoma. This is chapter one. The name of the patient is Garrett. I use his name with his and his family's permission. He was in an ATV accident without a helmet and was airlifted to our hospital. And by the time he got to the hospital, he had this CT scan, which showed a large epidural hematoma with midline shift, clearly an operative case, right? And it's a life-saving case, except for the fact that when I examined him, my examination did not elicit any signs of brainstem function initially. His pupils were large and non-reactive. He had no corneal reflex. He had no gag reflex, and he had no response to deep painful stimuli, and he wasn't breathing above the ventilator. And so we typically will not operate on a patient like that. That patient is either brain dead or very close to brain dead. But his CT scan looked so good, and it was such an easily treatable problem. I pinched him 4 or 5 times, and he didn't do anything. And then finally, the last time I pinched him as hard as I could, he extensor postured, meaning he wasn't technically brain dead. So then I'm in the impossible situation. This kid is likely to have a horrible outcome. I've seen so many patients like him as the neurosurgeon in a very busy level one trauma center for children. And many of them are in beds for the rest of their lives, fed by G tube, not responsive to their families. They don't follow commands. They require 24-hour nursing care, something that many of us wouldn't sign up for ourselves or for our children. Um, and the likelihood of survival is very, very low. So I detailed the discussion I went with the family. I wound up taking this kid to the operating room, and he's absolutely perfect. He has no neurological deficits. He finished high school. He was on the golf team in high school. He went on and got a job. He has training in a nuclear power plant, and he's a happy, functional kid, and he's absolutely normal. And to his parents and the rest of his family, I'm the hero. I saved his life, right? And they have nothing but gratitude towards me, bringing me gifts every year, singing my praises. But his case haunts me because when I'm honest, I advised the parents that if this were my child, I would not offer surgery, that his neurologic exam was so poor. I wound up doing the surgery, but I gave the wrong advice. And, I question sometimes, are there other patients like Garrett who I didn't offer surgery, whose life could have been saved and who might have had better outcomes than I thought? And the answer is I don't know. I can't think of any specific cases, but they certainly could be out there, and that absolutely haunts me.